Thank you. Welcome, everyone. Thanks for joining us tonight. Hold on one second. I want to check one thing. You got to love it. You hit the button. There we go. All right. So again, thank you for joining us tonight for this informative session on mental health and suicide prevention. My name again is Ellen Menendez, and I'm a social worker with the school behavioral health department for DCPS. So oftentimes we hear about homicides in our area, but we do not hear about suicides unless it's a murder-suicide. The truth is, suicide is a major health crisis. In this session, we will review the suicide rates nationally and locally for both adults and youth. We will also discuss warning signs of a mental health crisis, such as suicide, and how to engage a person who is having thoughts of suicide. We will conclude our session with resources to assist an individual with thoughts of suicide. So let's start the session with some true or false questions. Use the chat box to put a T for true or F for false. So the first question, suicide is the second leading cause of death for ages 10 to 34. Is that true or is that false? I'm seeing some trues here. Let's see. Absolutely. Unfortunately, it is the second leading cause of death, and we'll go into that a little bit more. Next question. Once that individual is suicidal, they will always remain suicidal. Is that true or false? Yay, absolutely, that is false. It's usually only for a brief period of time, and hopefully we can get them the support they need for ongoing support. Next, asking a person about suicide will encourage the person to attempt suicide. Thanks for that honesty there. Absolutely. So it is false. Talking about it will not give someone the thought of suicide. It actually serves as a deterrent. It allows them to feel seen and recognized, and somebody's there to help them. Suicide occurs across all ages, races, and socioeconomic statuses. Yeah, that's true. It occurs across all cultures and all ages. Next, suicide happens without warning. That is false. Generally, individuals give many clues regarding their intentions. They may not show every clue to every individual, but they do give clues typically. Parents, caregivers, and other family members play a vital role in suicide prevention. True. Absolutely. Thanks so much for joining in on that true or false. Let's get on with some great information we have for you. Did you know that 1 in 5 individuals have or will have or experience a mental illness in their lifetime? Did you also know that suicide rate rose 30% between 2000 and 2018? 45,979 individuals died by suicide in the year 2020, which is about one death every 11 minutes. The number of people who have thoughts of suicide are even higher, reaching 12.2 million American adults, with 1.2 million attempting suicide. Florida, suicide is the 8th leading cause of death for all age groups, compared to 9th leading cause of death nationally. As I mentioned before, the news reports nearly every homicide that occurs. As we see on this graph, which is reporting total homicides and suicides for all age groups in the entire state of Florida, suicide is more than double the number of homicides. There are safety reasons that suicides aren't shared on the news. This also limits awareness of the issue. Taking a step deeper, looking at only Duval data, we see suicides have outnumbered homicides in 4 out of 5 years. Both of these categories are difficult to process. They become even more challenging as we focus on age or youth, age 10 to 19. Sadly, when we drill down to just the youth aged 10 to 19, we see a different picture here in Duval County. We see that the youth numbers in homicide are outnumbering suicide. But we still see that there's an upswing in the number of youth dying by suicide. The age group 10 to 24 accounts for 14% of all suicides, making suicide the second leading cause of death for this age group nationally. Suicide is the third leading cause of death for this age group in Duval County. The leading cause of death for this age group nationally and locally is accidental death, which does include car crashes. In partnership with Wilson's Behavioral Department, I want to share a little more information about what is occurring in our own area. The number of emergency department visits for our youth have remained pretty constant over the last 4 years, averaging around 1,650 visits annually regarding mental health and behavioral disorders. Looking closer at reasons for the emergency room department visits, between the time 2018 and May of 2021, we see the largest reason was for anxiety, which goes along with stress-related issues, and also mood affective disorders, with the main two disorders being depression and bipolar disorder. What we see is a rise in emergency behavioral health admission rates. We know that 1 in 5 children live with a significant mental illness, with less than half receiving appropriate treatment for their illness. Half of all lifetime mental health issues start by the age of 14, 3/4 by the age of 24. On average, it takes 8 to 10 years from the time an individual begins having signs or symptoms of a mental illness and receive interventions or support for that disorder, if they ever do.
Hello, Mrs. Jones.
Hey, CJ.
Coach.
Emma.
Mom.
Last year, I experimented with painkillers, and then I started taking them every day.
174 days ago, I started intentionally vomiting after meals.
My anterior cingulate cortex has a population of overactive neurons.
Cutting my arms has become a compulsive behavior.
I started having suicidal thoughts.
Can you help me find the proper support and medical resources?
Can you help me research the best treatment facilities?
I'd love to chat with you about ideas on how to help manage this.
So yeah, don't we all wish youth were open and forthcoming with their struggles? It sure would make it easier to help support them if they did. So next, what we're going to do is look at some various signs and symptoms that could indicate a youth is experiencing a mental health challenge. Two of the frequent concerns impacting youth are depression and anxiety. Depression is different from typical sadness. It lasts longer. It feels stronger. It causes significant changes in day-to-day activities and can increase the risk of suicide. There are a wide array of signs and symptoms that youth may experience with depression. It's normal for youth to display some of these behaviors. When the behaviors are ongoing, impacting their ability to live, love, laugh, and learn, or lasting 2 or more weeks, they may need to be seen by their physician. These may have a physical cause or be indicating a mental health concern, which only a physician can make that diagnosis. Depression can look like changes in sleeping, eating, or hygiene, loss of interest in previously enjoyed activities, avoiding or withdrawing from friends and family, changes in academic performance and/or problems at school, feeling hopeless, worthless, or like a burden to others, trouble concentrating, lacking focus, or getting headaches frequently, lack of energy, lack of motivation, or feeling fatigued, tearfulness, anger, irritability, negative self-talk, self-injurious behavior, which quite frequently has other issues. They're coping with other things happening as well, and thoughts of suicide. So great question, Jacob. I see it in the chat there. By changes, you assume it means decline. So changes, sometimes individuals can be extremely withdrawn, isolated, depressed, sad, and then suddenly, like a flip of a switch, they're at peace or they're content or extremely jovial. That could mean they are having thoughts of depression or thoughts of suicide. And so we need to talk to them and be more engaging with that. So the other concern with youth is anxiety. Anxiety is mental and physical distress due to a variety of reasons such as genetics and or things occurring in life. Anxiety can look different in every individual. Experiencing emotional distress can impair youth ability to function day to day. Significant changes in the classroom with friends and at home are signs that they may need additional emotional support. Some signs of anxiety could include trouble controlling thoughts, worries, or panicking, avoiding people, places, or social situations, irritability, restlessness, being on edge, shortness of breath and chest pain, sensation of butterflies in the stomach or abdominal pain or nausea, constipation or diarrhea, racing heart or flushed cheeks, and tension-related headaches. Ongoing mental health challenges and other challenges in life could lead a youth to contemplate suicide. Youth can be impulsive and make irrational decisions forever changing their course of life. We as adults need to be aware of the warning signs and be able to connect with them to provide the assistance they need. Warning signs of suicide may include making threats of suicide, depression, anger, increased irritability, lack of interest, that drastic change in mood that I talked about earlier, being extremely withdrawn, isolated, depressed, and then suddenly like that flip of a switch, which could mean they've made a plan to die and they're okay in dying. Sudden increase or decrease in appetite, sudden changes in appearance, hygiene, decreased academic performance, preoccupied with death or suicide, and having made a previous suicide attempt. Now that we have an understanding about depression, anxiety, and signs of suicide, the next step is to start the conversation. This brief video will highlight important aspects of having a conversation with your children.
Parents, if you're watching, here are some tips on how to have those difficult conversations with children. First, start from a positive place by saying to your child that you love them, that you adore them. You could have the conversation when you've just shared a joke and laughed together, enjoyed a favorite snack, or watched a show together. I would avoid having the conversation when emotions are already running high or first thing in the morning when you and your teen might not be on your best form. Next, try to listen more than you talk. Listening is a difficult skill that requires practice, but it's so important that your child feels listened to. A good tip is to try and say about half of what you had planned to say. Also, be aware that your initial reactions, a comment, an eye roll, a sigh, can have such a big impact on your child and future conversations about feelings. Try to take a deep breath or sit on your hands before responding if you need to. Lastly, remember to work in partnership with your child and ask their permission on how they would like you to respond before jumping in to offer advice. They may just want to vent, or they might want to figure out the next steps on their own with your guidance as backup. The most important thing is to remind them that you're on their team, no matter what. Together, we can break the stigma around mental health. It starts with one moment, one conversation, one question. What's on your mind?
So as we saw, conversations about mental health concerns or topics can feel overwhelming and challenging. The first thing to remember is that you will not give the youth the idea of depression, anxiety, or suicide by asking about these concerns. Instead, Having an open conversation regarding mental health early with children will reinforce their comfort in sharing with you signs and symptoms of a change in their mental wellness. Use these points as a guideline. Choose a good time to have the conversation. Approach the topic while doing chores, maybe cooking, hanging out, or in the car. In a non judgmental way, let them know specifically what you have noticed and let them know that you're concerned about them. Actively listen to them, ensuring confidentiality with them unless it's life threatening. Reassure them that you will support them throughout this time and thank them for sharing this information with you. Inquire about how they would like you to respond rather than giving advice. Then work together to create a plan of action based on information shared to reach out to resources, developing self care actions, or simply following up with them. Just as we have do's for conversations, we also have a few don'ts. These are small tidbits that can really change the trajectory of the conversation. Be aware of body language and subtle responses that you may not realize are occurring, such as sighing and eye rolling. Even gasping at their statements could halt the conversation. Refrain from making judgmental statements. It is easy to think, you're too young to feel depressed, or your life is so good, what could be so wrong? These statements are not supportive and create a larger separation between you and the youth. The brain is an organ in the body, just like the heart, lungs, and kidneys. It may become ill at times as well. Don't compare their experiences to your experiences. Instead, be present with them. Use statements like, "This is hard for you. I hear the pain in your voice. I'm here to support you through this." Avoid becoming emotional while speaking to them. This could lead them to shutting down and feeling as if their story is too painful to share with you. Finally, be comfortable in sitting in that moment with them without changing the subject or attempting to cheer them up. It may be uncomfortable. Understand, this can be comforting for the youth just to have your presence with them and being listened to. During your discussion, you may identify some words or expressions that lead you to think the youth is considering suicide. This would be step 1, assess. Next, stay calm. Ask in a non-judgmental, neutral tone, are you thinking about suicide? Are you thinking about killing yourself? These are not easy questions to ask, especially to your own children. Understand that by asking, you are instead putting into words what they are already possibly thinking or feeling. Allowing them space to share their thoughts and feelings can actually serve as a deterrent. Take a moment, and I want you to say one of those sentences out loud to yourself in this moment. How did that feel to say those words? I know it can feel very overwhelming and unsettling. I like that icky. Yeah, they're very difficult. So it's definitely something you want to practice saying to get a little bit more comfort with it, but understand you'll never be 100% comfortable asking that question. It's very difficult. It's very challenging. But remember, you're doing the best for the person that you're speaking with. If they say yes about they're having thoughts. Next, we're going to ask about making a plan. Have you thought about how you would kill yourself? Have you decided when you would kill yourself? Have you done anything to secure the means that you need? Higher level of planning does mean they're at a higher risk. Lower level of planning doesn't mean they're at no risk. They're still having thoughts of suicide. It doesn't take long for a plan to evolve at times. If they are in immediate danger of killing themselves or someone else, call 911 and ask for a crisis response team member to come and support the person. If they are not in immediate danger, you can still call 911 if you're unsure of who else to call. Remember, you can always call the National Suicide Prevention Hotline or 211. If you know the person personally and you feel safe enough to transport them, you can take them to any area hospital or mental health facility for evaluation as well. No, you are not asking to participate in the planning. What you're trying to do is get more information so you can further assist them and you can actually relay that information to the individuals you're connecting to them. It's actually very supportive to actually get more information. And so we're not just finding out and then stopping the conversation. We're finding out more so we can provide the correct resources and support for them. And I'll help you determine, do I need to call 911 right now, or can I call their primary care physician in the morning? So it kind of dictates that as well. Understand that oftentimes in the midst of a crisis, it's difficult to recall services that are available for assistance. Those on the screen are just a few of the many in our area. We have a resource sheet that lists various supports in our community and organized by need as well. We will put that in the chat box for you so you can access that. We do want you to understand that you're never alone. The resource list is available in the chat box or on our school behavioral health webpage for more information. Students that do not already have a therapist or a counselor, and you as a parent would like to have them begin therapy, we have full-service school counselors available at every school. To connect your child with a full-service counselor, complete a full-service referral form and submit it to your school counselor, or call the counselor to inform them that you would like to make a referral. Once the referral is submitted, the counselor will forward the referral to our full-service social worker, who will then connect with you to ensure our services are appropriate for your child before assigning them to that full-service counselor. Full-service counseling does not end when the school year does. Many times, youth can begin and continue sessions throughout the summer with parent and counselor collaboration. The School Behavioral Health Department has an online self-paced training for community members, including parents, to learn more about how to identify and talk to individuals that may be having thoughts of suicide. It's a simple 90-minute online course. If you're interested in completing this training, please email me or complete the survey that I'll leave in the chat box for you. Finally, I would like to encourage each of you to increase mental health awareness in your homes, communities, and workplaces by engaging in activities throughout the month of May. May is Mental Health Awareness Month, and we have a variety of activities occurring throughout the month. In addition, schools throughout our area, along with community partners, will be participating in the Clothesline Project to bring awareness to mental health. Simply take a t-shirt, write an uplifting message on the shirt regarding mental health or a message of encouragement, and hang it in a prominent place. If you would like more information regarding the Clothesline Project or the activities for May Mental Health Month, simply email me and I'll be happy to send those flyers to you. I know tonight has been a lot of heavy information that we have covered. Please ensure to take time to process what you have learned and make sure you engage in self-care to take care of you so you can continue to take care of your own. To stay connected to School Behavioral Health Department, follow us on Facebook at DCPSBH or on our website, www.duvalschools.org/school behavioral health. Thank you again for this wonderful opportunity to share some wonderful information regarding mental health and suicide.